We're pleased to welcome you to the AUSA Noon Report, a new virtual series featuring senior Army leaders that provide important updates on key defense topics. Kicking off today's event is the President and Chief Executive Officer of the Association of the United States Army, General Carter Hamm.
Good afternoon and welcome to AUSA's Noon Report. You know, I've come to really enjoy these virtual events, but to be honest with you, I wish we could be together in person and to have some of these events. But it's just not possible in this current environment. So we've crafted a series of events to bring together senior defense leaders on topics of current interest. And we hope that you will enjoy today's presentation. Really glad that you've joined us today and very much appreciate your support. Our guest today is Lieutenant General Scott Dingle, the 45th Surgeon General of the Army and the Commanding General of the United States Army Medical Command. Lieutenant General Dingle is a distinguished military graduate of Morgan State University in Baltimore. His degrees include a Master of Science in Administration from Central Michigan University, a Master of Military Arts and Science from the School of Advanced Military Studies, and a Master of Science in National Security Strategy from the National War College. He's had all the tough jobs in Army medicine, to include multiple tours in Iraq. In my opinion, he is what I would call a muddy boots leader. But he also has wide experience in critical staff assignments in the defense medical community. In short, he's exactly the right officer to lead Army Medical Command and the Army's military medicine community at a particularly critical time. In the course of our conversation, if you have questions for General Dingle, please just use the Q&A tab on the right bottom side of your screen. And we'll try to get to as many of your questions as time will allow. But for now, General Dingle and I'll have a short conversation, and then we'll get to your questions. So General Dingle, welcome. We're really glad to have you here for AUSA's Noon Report.
General Hamm, thank you for having me. It's an honor to be here.
Yeah, you've been busy. Your command has been busy. You know, our Army medicine exists at all levels across the total Army, in every theater. You're everywhere. And as of late, your command and Army soldiers in the medical community have been intimately involved as the Army and the nation address the effects of the COVID-19 coronavirus. Can you talk a bit about what your role has been, what the Army's role has been, perhaps first talking about inside the Army, what have you done? And then more broadly, as many of us have seen, the great support that Army medicine has provided to civilian communities across the nation.
Thank you, General Hamm. It has been a very fast and furious, but yet wonderful experience as we respond to COVID-19 within the Army. As you know, force health protection is a priority. The Chief of Staff of the Army talks about people, the number one priority. And as we talk about people as the number one priority, we're talking about the soldiers, we're talking about the family members, as well as the beneficiary population. But as it gets to the readiness in the Army and those soldiers who must be prepared to deploy today, to fight tonight, and then Army medicine comes in to return them to duty tomorrow. We have looked at implementing a tremendous force health protection program that has protected the force. And so across the continent of the United States and overseas around the world, we have implemented our pandemic emergency response and preparedness plans. Those are protecting the force. And as we've nested with senior commanders around the world, around the globe, with the Army Public Health Center and the United States Army Medical Command and all the medical units, we've implemented on a three-phased approach of prevent, detect, and treat when it comes to dealing with this pandemic spread. And so the first is the prevention piece of training and educating our soldiers, as well as the beneficiary populations, how to protect themselves, how to protect the bubbles. We are nested with the CDC guidelines, with Health and Human Services, with FEMA, to ensure that we are putting out the latest preventive measure techniques to protect the entire Army family. Again, soldiers, family members, as well as the beneficiary population. And then if those preventive measures, are not sufficient and someone contracts it, it then gets into the detection phase. That detection deals with testing, the clinical procedures. If they're coming in and we are setting up the COVID screening locations across every installation, it has been a phenomenal response to ensure that not just detecting it on the beneficiary population and soldiers, but also the forced health protection of those healthcare workers. But we detect it, and if it's detected, we implement the proper protocols within our soldiers and our families to ensure that they're taken care of. And then all of our medical treatment facilities, if it comes to treatment, have responded in a phenomenal manner to support the beneficiary population in treating those who contract the COVID virus. Now, external to the Army, there's a saying that, run to the sounds of the gun. One thing that has been admirable with Army medicine is that you've had the healthcare worker communities, our MTO deployable hospital centers, our field hospitals, our healthcare teams that have just run to the sound of this virus. Whether if it's deploying to the Javits Center in New York, deploying to Seattle, setting up in order to not conserve the fighting strength in this case, but something that's been unique, conserve the strength of the American citizens. And so when it comes to the whole of government approach, Army medicine has responded not just in doing the research and development, the great things that the Medical Research Development Command and RARE and the Army Public Health Center are doing under the Army Futures Command. But what we have also done as we're trying to assist the research development of the vaccine and therapeutics, we're nested at every level within the government, from the Presidential Task Force to the COVID Task Force to FEMA to Health and Human Services, as well as with the industry, with academia. We are fully integrated and participating in the fight against this pandemic. And then as you move from the research development of vaccines and therapeutics, it then gets into the actual actions. I talked about the deployment of healthcare workers. Well, as we deployed our hospital centers, in New York and in Washington, what we discovered is that, what the states and the governors really required was healthcare augmentation. The amazing thing about Army medicine and these medical units and healthcare professionals is that they adapted and then they integrated into the cities, into the hospitals, providing that reinforcement support. It has been admirable. One thing that we did do within the Headquarters Department of the Army was we also modified the field medical station concept from Health and Human Services. Those are 85 member teams that are normally deployed in support of hurricane responses. And we developed what's called our Urban Augmentation Medical Task Force. Those are 17 85 member healthcare workers who deployed to support all the various governors and states across the nation. 17 deployed initially out of Compo 3 reserve. And so the response to the whole of government approach from the medical community has been multi-Compo 2. Let me get that in there. And so as those Urban Augmentation Medical Task Force teams deployed and now have redeployed, as we now continue support in the South and answering the call to the mission assignments for medical units, we now have additional Urban Augmentation Medical Task Force teams that are coming not just from our MTO deployable units, but also from United States Army Medical Command, where we have also provided an 85-member team to support Texas. And then this team is embedded, throughout the state of Texas to support the hospitals and where they are needed. The most admirable thing that just melts my heart is the response of the healthcare workers, not just active duty, but also the retirees. And I'm sure we'll talk about that here in a second also. But I could go on and on with what and how we've responded and how we've embedded across the entire force. One of the most amazing displays that I've seen, in my 32-year career was when the Chief of Staff of the Army, executed mission command in support of the whole of government approach. And what he did was he expanded the testing capacity within the United States Army to ensure force health protection and the readiness, of our families. And so we expanded the testing capacity within the Army under direction of General McConville from 9 locations to over 40 locations across the globe in support of readiness and the Army family, those people, the soldiers, the family members, and the beneficiary populations. And no good deed goes undone. And so as we expanded tremendously, we also found pleasure in providing the support to our joint force and to Department of Defense and to the citizens of our country in support of the Presidential Task Force of those non-governmental personnel too, as we're tasked. And so it has been and it is a tremendous response that I am extremely proud of. Army Medicine, the United States Army Medical Command, but just the Army, because the Army's response, it has been an Army response, not a medical response. And that's one thing under the leadership of General McConville and the Secretary, Mr. McCarthy, is that we've integrated medical at the headquarters department of the Army level. It's no just the medical guys, you go handle it. No, it has been an Army operation led by the Chief of Staff, our G357, and the entire HQDA staff. And that has what has resulted in such a remarkable response that has allowed us to be successful. And then the regional commanders, as hospital units deployed in support of the whole of government approach, that also impacts the healthcare at medical treatment facilities. Because now, as we pulled out over 450 healthcare workers, soldiers, to deploy to support the whole of government approach, the thing that we had to balance was, well, we still got to provide the care to the beneficiary population at your post, your camp, your station. The regional commanding generals, because they have command and control over the soldiers and the uniformed personnel within the United States Army Medical Command, did an exceptional job with cross-leveling to ensure that the ICUs, the wards, the ORs, that things still function in spite of losing 450 in support of a deployment. So they cross-level to sustain medical care across the entire Army Medical Treatment Facility footprint. In addition to that, when we incurred even more holes, then we cross-leveled across the United States Army Medical Command in order to ensure the sustainment of readiness, but also the health care of the beneficiary population.
So you speak with justifiable pride on all that the command has done. And as a soldier for life, I'll confess great pride in watching the total Army's response, particularly in the early stages as the COVID-19 pandemic affected so many of our communities. A lot of that initially was concentrated in the northeastern part of the country. Lately, we've seen a rise in the number of cases across the south and southeast. And of course, that's where lots of Army units are stationed. Has that rise in the number of cases, have you seen that within the Army units that are there, or have the preventive measures largely been effective?
Well, the Army is a microcosm of society. And so we also are experiencing a small spike because not just that, but we also have restarted the movement of our forces across the globe. And so those combat, are multiplied with the opening of cities, the opening of states, the returning to a normal where things are opening. Well, you got soldiers and family members that are there also. So there has been an impact. We have kept it to a small amount, even though we are also experiencing the same thing, but not in extremely large numbers. And I attribute it to, again, the what I call the discipline of social and physical distancing as we implement and follow the force health protection guidelines in conjunction with CDC guidelines. But with all things, there are always those outliers where that soldier or family member comes into contact with someone at one of the institutions that may have just opened up that are coming back, impacting our soldiers also. But again, we do have a tremendous force health protection policy that we've implemented from OSD within the United States Army that commanders across the globe and senior commanders are strictly adhering to ensure that we're protecting the bubble. Because in spite of anything that goes on, the spread, the United States Army and the soldiers have to be prepared to deploy when called upon, even if that is tomorrow. So we have a tremendous leadership push on the force health protection guidelines. We will experience those spikes, but yet we follow the protocols of restriction of movement, and we've been very successful.
So I think that this is a case where the discipline of
Yes.
of an Army soldier can really make a difference in controlling the spread. As you look at the activities that Army medicine has been engaged in from the onset of this pandemic early on in the spring of this year, how have you had to adapt the delivery of medical care to soldiers and other beneficiaries? We've seen reports in civilian hospitals where, because of the increase in the number of COVID-19 cases, they've had to curtail, in some cases, postpone or delay other more routine medical procedures. How is that? How have you addressed that within the Army medical community?
And in conjunction with the Defense Health Agents, we also curtailed those elective surgeries, elective procedures, and dental that were non-emergent. And so as we implemented that, that also allowed us to free up those workers to reinforce, the COVID pandemic emergency response and preparedness plans for the different installations and medical treatment facilities. And so as we now start to turn some of those services back on, we also are adjusting, leveraging retiree recalls to fill some of the holes as we open some of those elective procedures back up. Because we understand that first and foremost, that we must maintain the services that keep and maintain or sustain the readiness of our soldiers, as well as the emergency response to the beneficiary population, those key services. And so as we're adjusting to that, one of the initial struggles that I had within the medical command was the discipline of social physical distancing within the medical treatment facilities, trying to keep down the healthcare worker forced health protection numbers of positive COVIDs. Because again, the healthcare workers are at the front line. They're engaging with that enemy each day. And if we do not follow the proper medical protocols and the PPE, then our healthcare worker now goes down and are taking out for the 14-day period to let it run its cycle. If that happens, then that healthcare worker is impacting the services at that medical treatment facility. And so and a tremendous emphasis from myself, the commanding general, the chief of staff, and the secretary and the vice and the Army senior leaders also, as they visit the different medical treatment facilities, it also had to be a reminder to us, United States Army Medical Command, that we're not invincible and we must follow that same medical protocol to protect the healthcare worker. Our numbers at one time were, pretty, significant, but we were able to reduce that down through the emphasis. And I've not had a high number of COVID positives. However, any COVID positive is a concern because it's a healthcare worker, and our number one priority is their health first. And then second, they're the ones that are, as the chief of staff of the Army say, are the heroes of this battle on the front lines. Unsung, but they are just tremendous leaders through the force health protection. We're keeping them in the battle and in the fight.
Yeah, and I think, General Dingle, as in all things about the Army, leadership matters. And so the example set, the policy set and enforced by Army leaders, I think, have had a very positive effect. You mentioned the retiree recall, and I wanted to ask you a bit about that. And that got a little bit of a news flash when the Army first announced retiree recall. How's the response to that been, and about how many did you recall, and how long do you think you'll need that?
I think one of the first things that comes to mind when you ask that question, General Hamm, is the term soldier for life. Soldier for life. And as that phrase, those three words, soldier for life, that's not just a bumper sticker. And it was evident in our retiree recall process. When the sound of the call went out for volunteers, we received over 25,000 initial responses, over 25,000 retirees answering the call and saying, "Here am I, send me." Out of the 25,000, though, as we started sifting through the numbers with tremendous support from Human Resources Command at Fort Knox, the 25,000 were not the specialties and not medical MOSs and areas of concentrations that we needed. And so what were medical was about 6,000 of those retiree responses to the call fell in the medical lane. After we went through all the vetting processes and background checks, we ended up with about 170 today. We have 170 retirees that have deployed and are embedded across the entire United States Army Medical Command medical treatment facilities. Their stories are phenomenal. I was in San Antonio yesterday at Brooke Army Medical Center, which is right in one of the epicenters of providing support to COVID patients, not just military, but to the community. And as I was talking to a retiree recall, who is a doctor microbiologist from California, who is also a spouse, who is also a mother to 3 children, all under the age of 12. And the call goes out, and here she is in a very prominent position in the community as a microbiologist. She had in her heart the desire to serve, and she talked it over with her family, and she said, I have to answer the call to serve, the community, to serve the Army, to serve in the whole of government approach. And she asked her family, what should I do? What should I do? The husband and the children said, "Mom, you gotta go." But then they also said, "Mom, what can I do?" And she said, "Well, you can help your dad and cook, while I'm gone." But just that type of response from someone to deploy and answer a call to put their life on the front line of dealing with a COVID-19 virus that we're still trying to work the vaccine and therapeutics, and to put it all on the line to serve. And as she told me her story yesterday, it was just admirable, and it touched your heart, because that is the type of commitment that these retirees have brought to Army medicine. Fort Leonard Wood, Missouri, the leader of the process of the screening of initial entry trainees is being led by a retiree recall physician who has a passion to serve the soldiers in this country. And so I've just been blown away by the retiree recall response. I initially was only expecting probably about 50 or so to really answer the call, but it has been overwhelming. And I have hundreds of stories about retirees, healthcare professionals, physicians, nurses, dentists, doctors, providers who have a passion to put their lives on the line to serve. And it just blows me away. And so I just beam with pride and admiration in the Soldiers for Life and the United States Army Medical Department, and the commitment that they are showing each and every day as they're filling in the ranks in support of this pandemic.
Yeah, that's very impressive. And it does remind us that Soldier for Life is more than just a slogan.
Yes, sir.
It also is a reminder of how Army families continue to serve, and that really is important. I would tell you my own personal experience that when the retiree recall came, I found out that there is no requirement for a 68-year-old infantryman. It was like, no, we're not particularly interested. Well, let me ask you one more question, and we'll turn to the audience questions. And this is a question that you could talk about for days, I suspect. But I'll ask you just in a very almost concise sound bit. There's been a lot of talk in the Congress and other places about military medicine reform and all the rest of that. For service members and their families, for retirees and other beneficiaries, what would you say are the couple of key points to have in mind as this conversation and this medical, the potential changes and reform within medical community are discussed?
It takes me back to General McConville's words about people and how people are top priority and number one. And when he says people, he's talking about the soldiers, the family members, the civilians, the beneficiary populations. And so as we talk about transition, as we talk about change, as we talk about NDAA medical reform, the Chief of Staff of the Army is leading the charge to make sure that the soldiers, the family members, and the beneficiary population, our retirees, are taken care of. As we were deploying the units out of our medical treatment facilities, and I'm giving a report to the chief, and we're talking and synchronizing with General Flynn, the 357, and all the major commands. The one thing that was a constant was the senior commanders in the field, not the medical, the senior commanders in the field leading the charge, the chief of staff of the Army, the vice chief of staff, the secretary and under, leading the charge, asking the question about, are we impacting the retirees, the soldiers' readiness, the family members? We would not impact that. And so, Scott, you have to fix it. Which is one of the reasons the retiree recalls and the cross-level across the board. It was admirable to see how the Army senior leadership, how the senior commanders in the field, the 4-stars, and everybody was not just focused on the deployment, and what we're doing in the battle, but they were also focused on home station. The impact that those military assigned personnel being pulled out had on the services, and could those services provide the emergency response, the COVID treatment, the essential critical capabilities to conserve life and to treat sick soldiers, family members, civilians, and retirees at that medical treatment facility. And so as you talk the transition, initially, we were going down this lane as we talked about NDAA of separating healthcare delivery from readiness. One of the greatest things that we learned is that healthcare delivery and readiness cannot be separated. These are health readiness platforms. These are the venues that our providers, that our healthcare workers must work to, one, provide care to the beneficiary populations at your post-camper station, yet also to be ready to call upon to execute that Army's mission of to deploy, fight, and win. And then right along with them is the medical community deploying to deploy, to not fight, but to conserve the fighting strength and to turn them back to duty, return them to duty the next day. And so it was a understanding or an epiphany that hit everyone as we were driving hard to separate healthcare delivery and readiness, that, hey, we need to stop and make sure we get this right. And so from the Assistant Secretary of Defense from Health Affairs, from the Secretary of the Army, all the way down to every installation commander, to every retiree council, the concern was tomorrow. What about the care? And General McConville has led the drive on, we will not adversely impact the readiness and the care provided on our installations. And so we have taken the lead to ensure that there is no adverse impacts to tomorrow as we go and transition to whatever the NDAA end state is. And so ensuring that critical care, that as we conduct reform, that what the requirements for that community for readiness, for the beneficiary population are there. There is no negation or a turn away from the realization that those soldiers that we own, that are on that Army Manning document, have a key and critical role at every post-camper station. And so we looked at that, and we have reassessed, and we have ensured that services are sustained and that care will be provided under the policy direction of the Defense Health Agency as we ensure the readiness, again, of soldiers, as well as taking care of the beneficiary population.
Well, thanks for that, General Dingle. Obviously, an issue of great concern in the force and across the beneficiary community. It gives me great confidence knowing that you and the chief are leading that effort as we undertake this, and there'll be more to come. I'm sure, and we'll look forward to further conversations with you. So we'd like to turn now to audience questions. And General Dingle, you might see at the top of the list a familiar name. So the first question from your predecessor, Lieutenant General retired Nadia West, the 44th Surgeon General of the Army. Hi, General West. Thanks for joining us. And General West asked a question, a great question about virtual health, the delivery of health care virtually, as you have been doing, but perhaps expanded in this coronavirus environment. Do you see that? What do you see the future of virtual health delivery for the Army?
Virtual health telemedicine has blown up as the restrictions of COVID hit, our country. And again, the requirements for social distancing, the protection of bubbles to ensure that we're not exposing beneficiaries, patients, by coming into a facility or to a location. We have increased our virtual health, has increased 70%. It has been a phenomenal occurrence of increase in virtual health and the virtual medicine platforms. And so it has been so successful that we are throwing a lot behind the continuation, the improvement, the expansion. The Defense Health Agency has the lead on it. However, the Army has a big role in which we've not just only nested under that, but even us coming out and out of our own pockets to support and reinforce and expand virtual health across the Army medical treatment facilities, to include another piece of the behavioral health, behavioral telehealth. It has been an amazing increase as our quality of life task force within the United States Army talks about mental health and access to mental health. One of the best practices has been that behavioral telehealth. And so we have a full court press on the expansion as we partnership with the latest technology on the civilian sector and implementing it again across the entire Army medicine enterprise, because we're going to leverage it. And I think one soldier said it best, who was a leader. And this particular soldier said, I understand that we've removed the stigma and that there's no stigma, with going to seek mental health. But he said, one of the greatest things that encouraged me to seek help was that it was behavioral telehealth, virtual health. And he had the option to access and leverage the platform. And he said it was the best thing in the world and allowed him and many others, because then he spread the word, for more leaders to access and use the virtual health platform. And so it has been skyrocketing, and we'll continue to leverage this capability and, of course, integrate and bring in the latest civilian technologies in order to take care of our beneficiary population also.
So a follow-on question on the mental health provision related to the frontline workers that you talked about, those in the medical community and others that truly are on the front lines of combating the coronavirus. What do you have in mind, and what do you have to help that particular population work through challenges that they may be having in the mental health arena, given all that they're confronted with on a day-to-day basis?
Yes, sir. And the commanders, the Army Medicine Medical Treatment Facility or medical unit commanders, are fully integrated in what we call the behavioral health system of care. And so from the far forward care that is in their footprints, but it starts within the unit where commanders, again, are making sure that the resources are available, making sure that we are training and educating our healthcare workers, because what we will often do is we will just get into the OR, the ER, the hospital, and just grind and grind because they're so committed to conserving the fighting strength and saving lives of that young youth or that retiree or that elderly, but they don't take care of themselves. And so, starting at the command levels, implement a behavioral health system of care that ensures that we are looking at the man in the mirror, and that the services are there, and that we are making sure through the buddy system and partnering, and then it goes all the way up through the embedded behavioral health to the constant education, the standing down, and the timeout to make sure that we take care of ourselves at every level. But we have a phenomenal behavioral health system of care that ties into the actual appointments, whether virtual or non-virtual, to make sure that we are taking care of our populations.
Yeah, I think it's a particular challenge of,
Yes, sir.
caring for those who deliver care, because you're exactly right. They are so selfless, whether it's a medical professional or a chaplain or somebody like that is so focused on helping others that every now and then we got to make sure that we're taking care of them as well. So thanks very much for that.
And then one thing for General West, she had implemented under her leadership, it was under the Chief of Staff of the Army, the General Officer Executive Health. A part of that address, again, how leaders, the same way those same healthcare workers don't take care of themselves as they're providing support to COVID-19 and just working day to day in the ERs, ORs, and in those clinics, that mandatory stand down. And one of the things that that we incorporated in there under her leadership was that mental health piece. And one of the common threads was that, well, I don't need it, but yet when that healthcare worker, as well as that general officer or that leader or that command sergeant major, is forced to make sure that you take time out, and you get up, put yourself on the rack, and allow you to get that overall, that check from top to bottom to include the mental health care. Every last one of them come out where that is the best thing that has happened to us. And likewise, as we implement this focus in the healthcare worker community, I want to make sure that I find a way that the healthcare worker, that those physician nurses are doing the same thing, because oftentimes we're the worst offenders because we want to take care and save lives so much that sometimes we forget about taking care of that man and woman in the mirror.
Yeah, I think that's exactly right. And I would just publicly say, you got to make sure you take care of yourself. We need you. All right, through all of this as well. Well, unsurprisingly, given the national level discussion from the onset of COVID-19, a lot of national discussion about a vaccine. And so what's Army Medicine's role in that?
So Army Medicine is in full support of, again, the Presidential Task Force. We are in full support with Operation Warp Speed. We have the world's best, Medical Research and Development Command in RARE, where they've always been on the tipping edge of vaccine research and therapeutics development. And so we are fully integrated. We have been integrated from day one with the Presidential Task Force, the COVID Task Force, and providing that care, providing that research and development initiatives to the whole of government approach. Now, they were always and have always been connected with industry, with academia, and with government as they share the practices, the latest developments in research for vaccine and therapeutics. And so we are all in 150% with our scientists and our researchers, providing that reinforcing support as they share as a collective community. They have a very tight community. And so as Operation Warp Speed is designed to help advance and speed up the research and development of a vaccine and therapeutics and medical countermeasures to support, again, our nation and the world, as we fight this pandemic, as well as the distribution under General Perna's leadership, we're right at the front lines. And so we'll continue to assist, with that development. I cannot tell you when, that outcome is going to be, but we have the world's best and the Army's best, which played a huge role even with the development of the Ebola vaccine, all at the front line supporting the Presidential Task Force and Ambassador Burks and everyone, in this effort.
Yeah, obviously they're, very, very high on the national priority list, and not surprised to hear that the Army is fully engaged in that effort as well. So I got one more medical question, and then a follow-on, frankly, non-medical question for you. The medical question it relates to the National Defense Strategy, which outlines as one of its top priorities strengthening partnerships and alliances with others. Has how you have addressed COVID-19, has that created opportunities to strengthen those relationships with allies and partners within the military medicine community?
Absolutely. And I think, again, it's not just within the Army medicine community, it's within the Army community. And as I mentioned, how Army medicine across the board, commanders are bringing and synergizing us at the table. It was a beauty to watch it occur in Europe, in Africa, USARAF, in USAPAC, in support of the local nations too, as things were blowing up around them, but yet the force health protection measures that those commanders in the field were implementing were the best practice. And so as they're sharing those practices with those nations, likewise, the reaction and the medical countermeasures and things that those local nations were implementing, those commanders also were getting that information. We've had our public health environmental officers as well as our Army Public Health Center, as we're doing the surveillance of what's going on, all that information is collectively shared and absolutely establishes stronger alliances and international partners around the globe. And that sharing and that reinforcement, because at the end of the day, when it comes to that sustainment of life and that ask for help came into those commanders, there was always that tremendous response to our partners that have just strengthened the relationships. Phenomenal response in Korea. And again, it's every commander from the 4-star all the way down that have just thrown into this theater of operations, which is the globe, in ensuring that it's a response to conserve the life of human lives, to conserve human lives for the betterment and safety of all, as we also look forward to development of vaccines and medical countermeasures.
Well, thanks for that. Thanks for all of your insights. I think the one thing that is for sure is, as the Army's 45th Surgeon General, you're not going to be bored. You've got a lot on your plate these days, and we certainly applaud you for your effort, and know that that all of us stand with you to do our part to support. Let me turn to one other issue. As the nation has grappled with COVID-19, the nation has also been grappling with matters of race, inclusiveness, and social justice. As you are one of the most senior African American officers in the United States Army, and so as you look at that topic within your own command and across the Army, what are some of the steps that the Army ought to be thinking about to address those concerns, to make sure that the Army more effectively realizes its goal of being the organization that it wants to be?
No, that's a great question. And one of the things that the Secretary of the Army, the Chief of Staff of the Army, from day one to get in front of this was we have to operationalize our actions. We can't just sit there and listen, even though we're doing listening sessions, which is a step to addressing the issue. But the one thing that they've done and have been very aggressive, which I'm very proud of, is they're making the change or operationalizing initiatives to eliminate that unconscious bias. And I have been extremely not surprised, but pleased that as an Army, as swiftly as we are doing things about removing pictures and addressing these issues. And this is at the Pentagon and the Army senior leader level that is being addressed, and not just being addressed, but being operationalized and executed. And that's what we have to continue to do. So as leaders are conducting the listening sessions as directed by our Army senior leaders, every leader has that responsibility to do the same thing, to operationalize it. The policy is going to drive it from above, and we can implement things in promotion boards and other areas that eliminate unconscious biasness actions. But it's going to have to get down to the lowest level, that operationalization of the actions, to eliminate that unconscious bias, to eliminate that racism, to ensure that it's just not a bumper sticker of inclusion and diversity. Taking a look at your staff, at my staff, and as we talk it, how do I operationalize it at my level? And so as the operationalization of inclusion and diversity and listening sessions and addressing these issues up here, it has to reach the bottom level. And so every leader has that responsibility of making sure, again, that it's not just a bumper sticker, but doing that internal look at myself, after conducting that listening section with my squad, or my team, and what do I need to do as a leader at every level to make sure that it's incorporated. I think we will have a different, and I think a more successful approach within the military, because the military has always been a leader in tackling tough issues. And so I'm very optimistic and excited about the direction we're going in, that will give up, because it's giving opportunities of leaders like myself to achieve their goals and their dreams.
Yeah, thanks for that insight. I think it is useful for us to hear from senior leaders on this matter. What stuck with me most from what you just said was, this isn't somebody else's responsibility.
Yes, sir.
We each bear some
Yes, sir.
individual responsibility in this,
Yes, sir.
and that's an important component of this as
Yes,
well.
sir.
Thank you very much
No,
for
thank
that.
you.
And thank you, General Dingle, not just for your insights offered today. And as you can see, we've got a boatload of questions. We may have to have you back fairly soon to take on some of these questions about the future of AMED and the rest of it. But thank you for today. But thank you even more for your lifelong of selfless service to the Army and to the nation. It's a powerful example for all of us, and we're very, very thankful that you've joined us today. Thanks.
Thank you, General Hamm.
Before we close, just a couple of remarks about some upcoming events for our audience. We have a Thought Leaders webinar with Scott Lingenfelter, author of Desert Red Leg, Artillery Warfare in the First Gulf War. That'll be on August 4th. And on the 10th of August, another Thought Leaders session with Mr. Chris Brose, author of The Kill Chain, Defending America and the Future of High-Tech Warfare. Chris Brose, many of you will remember, was formerly the staff director of the Senate Armed Services Committee. And that event will be hosted by retired General Bob Brown, former commander of U.S. Army Pacific. Important insight about Mr. Brose's views of the future of defense. And on the 13th of August, we ask you to join us right back here for another noon report. And that one will feature Major General J.P. McGee, the director of the United States Army Talent Management Task Force. That'll be hosted by Lieutenant General retired Patricia McQuistion, our Vice President for Membership and Meeting. So 4 August with Mr. Lingenfelter on Desert Red Leg, 10 August, Chris Brose, The Kill Chain, and 13 August with Major General J.P. McGee and the Talent Management Task Force. To register for those events and learn more about them, just simply go to our website, ausa.org. You can learn about upcoming events. You can register for them on the website as well. And finally, let me thank all of you who are AUSA members. It's surprising to me that maybe some of you aren't AUSA members, and I don't really understand that. But for our AUSA members, we thank you for your membership. It is through your membership that we are able to deliver programs such as today's conversation with General Dingle. So if you are a member, thank you. Go online, check your status, renew if you need to. If you're not a member, please join us. Go to ausa.org. We welcome your membership in our organization. Thank you all. General Dingle, thanks once again. Thanks all of you for joining us, and have a great Army Day.